All right. Facebook says I'm live. If you can see me and hear me, if you just want to put a quick chat or a reaction out there, and I'll know we can get started. Looks like we've got a handful of folks here. There's my first reaction. Cool. So we'll get started with this free YouTube live. So glad y'all are here. I'm hosting these through the CNC Resourcing Inc., where we have other trainings and whatnot. If you want to get a replay of this, it'll be here on YouTube, and eventually it will also be in our um, gallery, if you will, of trainings that come with CEs once I get that all pulled together. So if you are interested in getting CEs, there will be a link in the chat here soon that you can go to, and you can join our newsletter so you can get notified when that's ready. Just a disclaimer here that none of this information is really to take place of any legal, ethical, or clinical consultation that you might otherwise get, right? Highly recommend talking to a lawyer who specializes in our field, talk to your supervisor, your mentors, your colleagues about the ethics around this, and about the clinical considerations regarding initial client consultations. And I will talk about what we're talking about, just explain what a consultation is, because I know that many of us use a lot of different words and phrases for that initial consultation with clients. And essentially, what I'm talking about is the meeting before the intake. You're talking to a potential client about what you can offer. They can ask questions, really get an opportunity, a feel for each other. Like, would this be a good fit for therapy? Should we move together towards this therapeutic relationship? And I think that that's something that I'm going to highlight today in our ethics, that it is about us making sure it's a good fit and the client making sure that it is a good fit. Um, Sometimes this is seen as a sales call, which it kind of is. You're selling yourself, which can be super awkward. And I hope that you might take the opportunity to do that, because as a client, I think there's a lot of benefits being able to meet with the person before you really dive into like a 90-minute intake and go through the whole insurance thing and pay money. It's really nice to just, even if it's 5 minutes, have a chance to talk to the person over the phone, over video, get to know them before you really start that therapeutic relationship. It can be used as a screening of sorts, right? If you are offering group counseling, for example, I think this could be the first step before doing an intake for group counseling as well. But it's for both of us. It's for the clinician, it's for the potential client. Often they are free. Sometimes they're not. Some folks do charge like a minimal fee for those initial consultations. And just know that they all come with different language. We all use different phrases. I know in my state, consultation is actually legally defined under the term counseling. So by my board, they mention consultations. And really what they're talking about there, I think, is more so working with other professionals about clients, the treatment planning, things like that, and also going over any results from any testing or screenings or assessments that have been done. I think that's really what they're talking about when they say consultation. But for me, it was important to separate the counseling consultation as defined by my board from what I offer to potential clients, which I call a meet and greet. Really up to you. Again, talk to your legal advisors around how to phrase this and how to advertise it to potential clients, so that you're meeting any requirements, maybe your state or state boards, or boards plural, in case you're licensed in multiple states, that you're following all those guidelines. I think it's helpful in these initial consultations to take some time to make sure that the potential client understands some of our business policies. One of those I've kind of already touched on, but do they want to use insurance or not? can that clinician, can you use their insurance, whether as an in network or out of network benefit? And I will talk about towards the end one special consideration for out of network providers. But can insurance be used? Do they want to use insurance? What are the fees? Things along those lines, as well as therapeutic approaches. So, what sort of clinical orientation do you have? Some potential clients are going to come to us wanting certain things and knowing about certain approaches that either do or don't work for them, whereas others may come to us thinking that a certain orientation works a certain way when maybe it doesn't, or maybe we don't use it in that way. So this is a really good chance to clarify the specific techniques that we use and how that might be used with those potential clients. We're also looking at a lot of options with in person and virtual therapy. So, if you are solely virtual, that's a really good thing to make sure that the client understands. And I use my meet and greets, my initial consultations, as a test run of if they can use my Zoom services. So, I use the Zoom for healthcare with the BAA and all that. And it's a really good chance to see, has this person ever used Zoom before? And whether they have or haven't, can they use it? Are they able to access it and get on to that meeting? Also, a chance to test out your EHR. I'll talk about using that for initial consultations too. If you are solely virtual, if you do nothing in person, then I think this is a really good opportunity to test out how well the client can use the different programs that you have. And then, do you need to offer any support? How can you help them figure out how to use those programs? If you are in person, that is, again, another important thing to discuss with the client. Where is your office? Do you offer things like walk and talk therapy? Um, for me, I think it can be really helpful to figure out, like, if you're in an office with an office building with other offices, which one is yours? And what do I do when I get there? Where do I park? I know you can put a lot of those things on your website, but that kind of helps take the edge off, the anxiety off, figuring out how to get there and what to do once you're there in person. And of course, these initial consultations allow us to connect with the potential client around their presenting concern or concerns, and whether or not we are able to address those ethically and appropriately. And then also, does our availability match? I mean, that is often the one thing that kind of keeps me from moving forward with potential clients, is because our availability just doesn't match. So that is also helpful. Are they looking for weekly? Are they looking for every other week? Do you offer that? And what time slots or days do you have available? You all know this, but I'm just kind of setting us up for what we might talk about in the initial consultation, so we understand why it's so important to have these, and also how to do them ethically. I mean, this really can help us to avoid headaches, um, anything that might get in the way of our therapeutic services meeting the needs of the client. And it is also a great place to start building rapport with the potential clients. The ones who come in where I've already met with them in an initial consultation, I feel like we've already got somewhere to start. We've already met a little bit. And mine are over video, so it's pretty much the same way as we would meet in a session. So we've already got that kind of vibe going. We know what it's like to meet virtually. For some of you, these may be over the phone. So it may be that you don't actually see the person until you're in the office and meeting, because you've done it over the phone. But yeah, I think that either way, these can help to address uncertainties, any concerns that potential clients have, especially for folks who have never been to therapy before. Then this is going to be really helpful for them addressing their concerns. I think often consultations, what I see is they are about 30 minutes or less. I mentioned few ways that can be done: phone, via video. I think also, if this works for you and this works for the clients you want to work with, in person also would be a great resource to invite them in person. Some of these are free, Some of these have a fee with them. There's no judgment here on how you set it up, the length, how you meet, whether or not you charge. These are all decisions you have to make based on your clinical approach and your business approach as well, right? So just checking the chat here, somebody mentioned that it's really helpful. A lot of folks are here first time working with clients, and virtual may eventually be in person, so may be unaware of the different ways of offering consultation. Yeah, happy to provide the different versions of what this will look like. Some pieces of information that should be gathered before the consultation call. First and foremost, and I will try to teach you some of the lessons I learned the hard way as we talk about this. First and foremost, don't just get contact information. Also, make sure that you are asking them the best way for you to contact them, meaning the potential client. So it used to be that I just gathered contact information, phone, email, stuff like that. And often I would reach out and I would never get a response from the potential client. So I started asking, and this was based on someone's suggestion, that what is the best way for me to contact you? I know I'm gathering phone and email information, but how would you like me to reach back out? Is it phone call? Is it phone via text? Is it via email? And that way you know what their preferred contact method is. And you're going to have much better chances of getting a response if you reach out in the way that they want to be contacted. I think we all feel this way, right? Like some of us, we like phone calls, some of us enjoy emails. I just set up with a new provider and for my own services, and she's all text. So good to know. Her intake forms were via email, and then we texted from there on out. So it's really good to know for both of us. Um, so yeah, just noting what is your preferred contact method. And then it can also be helpful to indicate your preferred contact method. Just like the new provider that I'm meeting with, it's helpful for me to know that if I text, then she's more apt to get back to me, like if I need to reschedule or something like that. So it goes both ways. And I think the key contact methods are email, phone, text, and phone call. And then once they're set up as an actual client in your EHR, maybe you've got that secure messaging. But really, those are kind of the three top ones that I run across with potential clients and clients. Another one is what state are they located in? This may not be as much of a big a deal as we get our counseling compacts in place, but still, you're only going to be licensed or you're only going to have privileges, a privilege license to operate with clients who are located in those other states. So I have had potential clients reach out and they are in another state and I can't help them. I can talk to them, of course, and let them know, like, hey, I'm not licensed in your state, but it's good to know ahead of time before you go through the whole consultation process, or hopefully not the whole intake process, but before that, what state are they in physically so that you know whether or not you are licensed or have a privilege license to support folks who are physically located in that state. That's probably a bigger discussion for a different day, talking about the legalities around that. But just know, where can you legally provide services, like where's the client located more so than where you're located, and getting that information ahead of time. Now I can go and check, okay, what state are they in? They're in North Carolina. We're good. I can support them. It can be really frustrating if we do end up meeting with clients who aren't in our state, but we're a really good fit. And that definitely has happened to me. So I try to offer referrals. I try to help find folks who are licensed in their state. That's going to be a you call on how much you help with that, but it's really important for my practice to offer referrals if we're not the one to be able to help them. And it usually doesn't take me too long to do that. And then the third thing to gather before the actual initial consultation, what services are they looking for? This will help you to structure that consultation session. In mine, The form that they fill out has a whole list that they can check off which services they're interested in. So I know from the get go when I meet with them, hey, it looks like you're interested in ongoing counseling services. And we can talk some more about that. We've got a starting place to talk instead of not knowing anything about why they're coming. And I'm not asking them for their presenting concerns. I am asking them what services they are looking for. And it could also be that maybe like I will do assessments for accommodations, for example. And if I don't have that availability, it's helpful for me to know if someone reaches out saying, "Hey, I need some accommodations. I'd like to do an assessment." Well, I don't have availability for that right now. Whatever that looks like, it's going to look different for you. Do you offer couples or not? If they're looking for couples and you don't, well, it's good to know ahead of time so that you can let them know. Some of you who take insurance, you may gather insurance information up front, especially like which insurance companies or policies they have. Maybe not gathering the full information yet, like a copy of their insurance card, but at least knowing what companies they have policies with is going to help you to determine whether or not you can help them if that's what they're looking for. They want to use their insurance benefits. If you don't take insurance, then also making sure that potential clients understand that you do not take insurance. And I know for many private pay clinicians, they will have a checkbox when someone is requesting an initial consultation that says, I acknowledge and understand that you do not take insurance or you will not file insurance benefits, whatever that looks like, whatever language, some sort of acknowledgement that you don't take insurance and they understand that. Another acknowledgement that you could get is from clients their understanding that it's just a consultation and it is not an intake. Some potential clients may not know the difference. So it can be really helpful to go ahead and put that out front of what is this like? And we do that when we send information for folks who have signed up for initial consultation. We provide them with a brief overview of what to expect during that initial consultation. It's not quite like an agenda, if you will, but maybe an outline of what to expect, as well as some suggestions of what we might talk about and questions that they can ask us. So there's going to be some questions that we might ask them. We let them know that as well, but then also give some suggestions of questions they might ask us. I'm sure that if you've done initial consultations before or just met with clients ever, they often have the same questions coming into a new therapeutic relationship, right? So go ahead and put those questions out there. Let them know these are frequently asked questions or these are topics that we'll go over. All right. So I'm not seeing anything in the chat, so I'll keep moving. But those are three key pieces of information to get before you ever have that consultation call. Their contact information and the best way to contact them, what state they're located in, and what services they are looking for. I've got a couple of strategies for how to structure the consultation session in a clear and professional way. And this isn't just for potential clients. It isn't just helpful for them. It's helpful for us. We know where we're at in the structure, especially if you have very time limited consultations, then you know where you're at in that structure and what other topics you have to cover and what topics you have covered already. It helps keep you at whatever that time limit is. It can also help to prevent the potential client from sharing too much. We'll talk some about the ethics and considerations around how much should a potential client be sharing in just a consultation if it's not an intake. And if there's a concern about them sharing too much, then that is another way to kind of limit that. So, the first strategy here is to start the session by explaining the purpose of that consultation and give some brief insight into how it will go. I know that you might have already sent that out to them, but it's helpful to just get everyone on the same page before you actually start the consultation. Again, noting this is just a consultation, it is not an intake session. maybe making a disclaimer that you're not actually starting a therapeutic relationship. And in my state and with my board, the therapeutic relationship does not start until you've signed, both of you have signed the professional disclosure statement. So that is important to let them know, hey, we're not starting services right now. This is just a conversation. This also helps to encourage them to use the time to assess if it's a good fit because they know what you're there for. Um, Explain that you will answer questions about your qualifications, approach to treatment, any information that they might need to make sure that it's a good fit for them. Again, depending upon your approach, you might caution potential clients from sharing details or asking for advice, or at the very least, let them know that you won't be giving any therapeutic advice during that consultation. Also, remind them that there's no diagnostic or therapeutic services that happen during the consultation. If you have someone coming in and they have never gone to therapy before, they may not understand that. So it's really important to just let them know, hey, there's not going to be any diagnosis here today. We're not actually going to get into therapeutic services. This is just a consultation. And for me, I think it's really helpful as like the last thing as I'm introing the consultation to emphasize that it's only going to last a certain number of minutes. So that's a reminder for myself, but also a heads up to the person I'm talking to that, hey, we have a cutoff time in 20 minutes or whatever that might be. And then, as the second strategy, as if that wasn't enough, invite the client into the conversation. This is where knowing what they're coming for is really helpful because you could make a statement like, I see that you're interested in learning more about individual counseling. Would you like me to start with information about myself, or did you bring questions that you'd like to ask? That's how we always start ours. It's just reiterating, hey, you're interested in learning more about these services. I'm happy to share about me and my approach. Or maybe you brought questions that you'd like to ask. Where would you like to start? And that gives that potential client an opportunity. If they do have questions, they can just jump right in. Maybe they've already read through your website and they're ready to go. Or maybe they want you to start and it takes some of the pressure off of them, I think. So that can be helpful. Let's talk about some ethical standards that are involved in initial consultation. And I'm going to be focusing on the ACA, American Counseling Association Code of Ethics. And to be fair, I have kind of put these under 5 topics rather than 5 standards. There's more than that I'm going to mention, but I've kind of grouped them together. So we'll start with informed consent. And the exact ACA standard is A2A, informed consent. And this standard applies to our initial consultations because it reminds us that clients, potential clients, they have the freedom to choose whether or not to enter into a counseling relationship. And this initial consultation gives them an opportunity to make that decision. The informed consent standard also notes that clients or potential clients, they deserve to get adequate information about the counseling process and the counselor. That's us. So there is a bit of informed consent that starts in that consultation. It's not as much as them, filling out all your documents and going over it, reviewing it in that intake, but it is still a part of the informed consent because the whole point of consent is that they get to choose whether or not to move forward with the therapeutic relationship. The next chunk is around termination and referral and non discrimination. So the ones that are under that are A11A, competence within termination and referral. And while I always think it's helpful to talk about referral from the very beginning, I think what we're really talking about here is referrals. So, what if we don't have the competence to meet this potential client's needs? Well, in that case, per the standard, we would avoid entering or continuing that conversation or starting the relationship or continuing a relationship, of course. We are knowledgeable. We're expected to be culturally, clinically aware and appropriate and have those referral sources to offer if we are not the best fit. So, the competence with referral, does really start with that consultation. If we find we are not competent to meet their needs, then we shouldn't start that therapeutic relationship. And we should have appropriate referrals for that potential client. If they decline the referrals, that's a whole nother story. But I think for just a consultation, that usually is the best place to go with anyone that's not a good fit. Hey, can I offer some referrals? Pull those together. Like I mentioned, if you're not in the same state. The next one under this topic is A11B, values within termination and referral. So, also, we would refrain from referring prospective clients based solely on our personally held values, attitudes, beliefs, and behaviors. This is an expectation for us to respect the diversity with clients and seek training. So, we are not referring because we don't want to work with them because they don't match with the value. The referral should really be about our competence, not around our personal values. And this is something to explore with a colleague, a mentor, a supervisor. Don't make this decision just right off the bat. Definitely have this ethical discussion with someone else and go through that process to determine whether or not it makes sense for you to work with this potential client. And then, of course, refer when appropriate. And then the last one under this topic is non discrimination. So, C5, non discrimination. We do not condone or engage in discrimination against prospective clients. And prospective clients are mentioned in the ACA Code of Ethics. They are mentioned several times. So that is referring back to somebody that we are meeting with, that we have not started the therapeutic relationship, even though initial consultation, that's not mentioned really anywhere in the Code of Ethics. Potential or prospective clients is, and that's where these come into play. The next topic is around respect for privacy and confidentiality. So we've got B1B, respect for privacy. We respect the privacy of prospective clients, and we only gather information that would be beneficial to the process. B1C, right after that, respect for confidentiality. We also protect the confidential information of prospective clients. And this also falls within disclosing information. We only do that with appropriate consent or with that legal or ethical justification. So, if you are gathering information about prospective clients, if you are taking notes on your initial consultation, whatever that looks like, if it's on paper, if it's in your EHR, if it's just typed up into a Word document, all of those are securely saved, then making sure that it doesn't get released, like with the confidentiality and with the privacy, that we're not asking too much of prospective clients before we've even started a therapeutic relationship. So I think that these often get looked over, the privacy and confidentiality. That's why I talk about them so much in all of my trainings. But this is really important to know that it also refers to prospective clients. It's not just about clients we've already set up a relationship with. The next one seems pretty straightforward, accurate advertising and representation, but always a good reminder that there are a couple of codes related to this. So C3A, accurate advertising, C4A, accurate representation. This is about identifying our credentials in an accurate manner, not being misleading, not being deceptive about our credentials, either in advertising for prospective clients or during that consultation. And then accurate representation. So don't claim or imply that you have qualifications that you don't have. And if there are any misrepresentations, we correct that too. So for me, in a consultation, example of this might be if somebody notes my PhD and they say, "Oh yeah, you're a psychologist," then I would need to correct them. My PhD is in our field. It's in rehabilitation and administration, rehabilitation counseling administration, but I'm not a psychologist. I'm also not a psychiatrist, which I like to remind people. I might be a doctor, I'm not that kind of doctor. So it's really important that even if it's in that consultation and they mention it, and there's no harm in them, meaning to mention it, but we're just gently correcting that. Like, actually, I'm not a psychologist. I have a PhD in rehabilitation counseling administration, just so that they know and that we're clear. And then the last one is contributing to the public good. So this one, I think we could apply to those free initial consultations, right? It's the pro bono aspect of our work. C6E, contributing to the public good. I think most of the time the standard is applied to offering free or low cost services, whether to clients, like a sliding scale, whether to the community by doing presentations, um, maybe with supervision, offering a reduced fee, whatever that might be. This is about doing something, some sort of service for little or no financial return. And I think that initial consultations could also fall under that. There's no guarantee that this initial consultation is going to go anywhere. There's no guarantee that this is going to turn into a therapeutic relationship or even one that lasts very long. There's no guarantee that this particular person we're helping is going to refer anyone back to us. But it's still a service we can offer that I think falls under this. There is no definite that we will get a financial return. So I've been talking for 30 minutes. Just see if you have any questions. I have some additional thoughts. Um, and it looks like we've got some of the resources. For some reason, the links didn't come through. I'm going to put those in the chat, hopefully with the link there. So these are some of the resources that I looked at when preparing for. Oh, I see, because the link is too long. Okay. I'm gonna try to get this to go through so that you can get the links. So the first one is from the APA, and they put out a um article on, like, they say free sessions, but really what they're talking about is initial consultation. And I think they have a really nice mix of voices in the article that talk about like the pros and the cons of this, the ethical implications, the legal ramifications. So that APA article, if you are on the fence about providing or continuing to provide those initial consultations, I think that that would be a really great article to review and just go through and compare some of the pros and cons that they mention and any takeaways that you can from guidance that they give around how to do it. Um, I just think that that was a really helpful article for me in preparing for this. And then I put a couple of, I guess, podcasts, you could say. So the first one is from the Therapy Reimagined podcast. They had one episode just on the initial consultation call. And I didn't agree with everything that they said, but I think that a lot of it was really helpful, again, for me in determining how to like set up this conversation, but also to figure out like what is the initial consultation call, what's the purpose of this, and what discussions might happen. And you hear the two hosts that they actually do kind of go back and forth in some disagreement over some of what they're talking about, as far as like what to ask, what not to ask, what to reply to, whatever that might be. So you get, again, a couple of different voices around initial consultations. And then the last one there is a YouTube video. If my views go down, I'll know you've jumped over there to watch that video. But this was also really helpful. And I put it last because I think the first two, kind of reading the article and then listening to the podcast, as like a base, and then listening to this video or watching the video can be really helpful in figuring out, once you know how you want to structure them, what do you want to incorporate into the consultation call going forward. So in that particular YouTube video, there's the host, and then they're interviewing someone about their process. And they do provide, I think it's like a 5-step structure. So I mentioned a couple ways you could structure it, but they actually have an agenda of sorts that they go through during their initial consultation calls. So if you're looking for something like that, then that particular video might be helpful. Again, I don't agree with everything that's in there, but I do think that there's a lot of really helpful information if you're looking for more guidance around how to create that agenda, how to create and schedule it, how long it should be, what topics should come up, things like that. And now I'll head into my additional thoughts. And if these bring up questions, let me know. From those three resources and from my own perspective, I think the initial consultation is about balancing business with care. And really, the number one priority, regardless, for all of us as mental health clinicians, is to get the potential client with the right therapist. And maybe that's us, but sometimes it's not. Sometimes it's with others. So, can we help to offer referrals and suggestions of others that they can go to? I'm sure we've all heard the stories of potential clients who reach out and never hear anything back. And again, no judgment to the mental health clinicians that that happens with. I know stuff ends up in spam, whether from the client or to the client. I know that some of us are so overwhelmed, we just don't have an opportunity to get back to people. But at the end of the day, it's really important to me. So, this is Dana's opinion, that if I'm not the right fit, I help that person find someone who is. And the starting place for that is by offering some referrals. These initial consultations show your brand. They show what is important to you, how you want to approach these conversations. It is that opportunity for advertising, right? Making sure that you're sharing accurate information about yourself and about your services. This is an opportunity to showcase your brand, who you are as a clinician, as well as, depending upon how much control you have, what your private practice is about as well, or what your health clinic is about, whatever it might be, wherever you might work. Yeah, somebody mentioned at bare minimum, responding when people reach out can be very scary. So, a lack of response could impact their decision to reach out to other mental health clinicians. Absolutely. They might feel defeated if they don't hear back. So, they might not continue to reach out. And I know that some folks are reaching out to multiple of us at one time, which, like, kudos, you should be. Reach out to as many people as possible to find that right fit. And that initial consultation is going to help with that. If you are at capacity and you just cannot take on anything else, you don't have an admin to help you, consider putting up away messages like auto reply to email, change your voicemail, just letting folks know that you're not taking clients currently. And that can be scary from the business mindset, of course, because you're like, but what if I miss out on something? And at the same time, this is about being honest and truthful in our advertising and representation. And I think this leads me to my next point. Be honest about termination and referral. I said earlier that I think termination conversation should start the first time you meet with someone. And I always tell this, especially to students who are doing their clinical work at my practice. Eventually, you're going to have a school break or you're going to graduate, and they need to know that at some point you're no longer going to be with the practice. So having that type of termination conversation at the top is really helpful. And then for those of us who are licensed and seeing clients on a long-term basis, I always let them know during the consultation, during the intake, if I'm ever not the right fit for you, whether that is today, next week, next month, or next year, please let me know so I can help you find someone who is. So that could happen before we even start a therapeutic relationship, but I also know that it could happen several months in. Sometimes we just need to refer. It just happens. So being honest and upfront about that at the very beginning, I think is really, really helpful and can make that space for potential clients and clients more comfortable to know that they can come to you if anything ever changed and that you would support them in finding resources. Reflect on any common concerns or questions that typically come up when you're first talking to potential clients and figure out how you can incorporate them into this first conversation, that initial consultation. Like I mentioned earlier, you likely have those FAQs, frequently asked questions, that come up again and again. What are your fees? How do I pay you? Do you take my insurance? What's your availability? Do you offer this type of therapeutic approach? Have you ever worked with this type of client or presenting concern? Okay, reflect on all the conversations you've had with potential clients and clients before and start to make up a list that will help you inform your initial consultations going forward. Think about how to incorporate them. And this is also really helpful to talk through with colleagues. Like, hey, what questions come up for you often in initial consultations? Or how do I incorporate this particular topic around fees into my initial consultation? Um, some of these topics can be uncomfortable. Like, let's just be honest, they can be. And at the same time, it's key in being ethical in our initial consultations that we are upfront and honest about those things. I think this is a Dana opinion, so take from it what you will. I think we should be cautious about getting too into the weeds, so getting too caught up in our potential clients' concerns. And what I mean by that, as just an example, is one of the suggestions in those resources I gave is to ask about risk, specifically like level of thoughts of suicide, that type of risk to harm or harm to self. If that comes up and they say yes, how prepared are you to support the person? If you're over the phone or over video, do you know what their location is to send resources and support? Do you know what services are local to them? So even if you're in the same state, like if you're across the state, do you know what sort of resources and services are available over there? And what if they're not from your state? Like, let's say you didn't ask the question about what state they would be located in. How do you figure that out? And how do you get them connected with resources? And then the next question I ask you is, if you get into this level of detail, at what point do they become a client? I know that in my state, officially, that counseling relationship does not start until both parties have signed the disclosure statement. But at what point are they then under our care and are we responsible for what happens next? So be cautious about asking some of these questions and getting too deep into things unless you are prepared to support that person, whether that means during the call or whether that means knowing what services are local to them, like a walk in clinic, for example. Or in my state, we have mobile crisis where they will come to you. But mobile crisis can sometimes take 6 minutes or 6 hours. So, also knowing that. There's a lot of considerations to be had around that. On the other hand, don't wait too long to get into logistics. So if you're talking about money and scheduling, make sure that that comes up earlier in the conversation than later because, and I've made this mistake, so I speak from experience, if you get too like into a conversation with someone and they feel like you're a really good fit and you feel like they're a really good fit and y'all are set up and ready to go and then you find out, right, I don't take your insurance and you want to use insurance, or I only have Wednesday afternoons available and you can't meet Wednesday afternoons, and then both of you end up heartbroken because it isn't matching up. So don't wait too long to get into the uncomfortable logistic conversations and topics like money and scheduling, especially. I think you can use the initial consultation to discuss your process. So, how many sessions do clients usually do? What kind of frequency are they looking for? What's the level of need or urgency? You can talk about this obviously in the intake as well, but it can be helpful to start that conversation in the initial consultation about your process, what that looks like, what they can expect, what questions they have about it. In the resources, they specifically mentioned, I think it was in the podcast, they mentioned like, what if a client comes to you seeking EMDR, you offer EMDR, but they don't know anything about it. So, how do you give them a realistic expectation for what that initial process is? You're not going to just jump in and start processing things right away. Like, what does it look like at the very beginning, making sure that they're stable and safe? I don't do MDR, so hopefully that's a good enough example from what I know of it. But it's not just as simple as like maybe what they see on TV or what they've read in an article. So we want to make sure that we're accurate in our representation, back to ethics, and that they are knowing what they're getting into. Keep in mind that initial consultations are going to look different based upon who the client is. So, is the person reaching out for services for themselves because they are an adult, they're in the majority, wherever that state is, they're in the age of majority, they can seek services on their own. That feels a little bit more straightforward than, let's say, parents reach out to set up services for a minor client. That's going to look different. Who are you involving in that? Is it the parents and the client? If there are multiple parents, are they all involved? Some of that's going to be a legal question, so not a Dana question, but a legal question for an attorney. But those are things to consider, like who's going to show up. For us, even though we only work with adults, so in our state 18 plus, you can seek your own services, there are times where folks will come to an initial consultation and they want to bring someone to support them. So maybe that is a partner, maybe that's a roommate or a friend or a parent, whatever that might look like. Are you okay with that if someone, a supportive person, comes to that initial consultation? And then that leads me into, what if you're working with couples, relationships, families? Who all needs to be there in that initial consultation? Are you having multiple initial consultations? I don't know. That's going to be something for you to work out for your process and the types of clients that you work with. But these are all really good questions to ask yourself before you're actually doing those initial consultations and you have someone reach out. I mentioned some information to gather at the beginning, before you ever have the initial consultation. And I think there's some more that you could gather either before the consultation or during the consultation. So, one of those would be, is this a referral? And if so, who referred them? So, was someone else full and they thought you'd be a good fit, so they referred them? Was it their medical provider who referred them over for something very specific because that is your expertise? What's that? How did they find you, basically, right? Like, how did they find you? Was it on a directory? That's going to give you some insight into maybe what they're looking for and what questions they might have. One of the places they could find you, if you are currently in network with an insurance panel or previously in network with an insurance panel, it is possible that they found you through their insurance company's website and that directory. And yes, even if you have depaneled, so you've come off of an insurance panel, you may still end up in the directory. So that would be a reason to ask this question, like, where did you find me? Because if they're looking for someone who takes that insurance and you no longer do, but they still found you on the directory, you want to clarify that from the very beginning. And then another question I think is important is, have you viewed the website, or what do you know about me? How much have you looked at? Some folks will just go to a directory and they'll just send out like 10 messages to people that seem like a good fit, but they might not have read through everything that you had. And so that might mean that you're not the best fit because maybe there was something in there that didn't match up, but they didn't see that, which is totally fine. Again, it's an opportunity to provide a referral to someone else. Um, but often for those that I ask, like, have you viewed my website? And they say yes, then I can just kind of go through my checklist and say, okay, so what questions do you have about my fees? What questions do you have about using out of network benefits? What question, because I know they've hopefully already seen it, but it also is just a double check to make sure that they have and to see if they have any additional questions. So someone mentioned when we do a referral, do we need to contact the therapist we're referring the person to? This is a great question. And I think, to be fair, there are multiple right answers to this. If let's start from like a current client. So this is someone you already have a therapeutic relationship with. This is someone you've been meeting with already, and you decide that they need maybe additional services or they need to go to someone who's more specialized. In that case, you might talk to the client about what would be most helpful. Well, in all cases, ask the client what would be most helpful. Would they like you to do a warm handoff? So reach out to that provider, or do they just want a list of providers to reach out to on their own? If they do want a warm handoff, just remember to get a release of information so that you can reach out to that other person and say, hey, I'm referring client so and so. Here's what's going on. They'll be reaching out, or whatever the case may be. If they want to reach out on their own, then they can. I always encourage current clients who decide to reach out on their own to let the person know that I sent them, because often those are folks that I know and trust, that I've been in maybe like a consultation group with, or that I have referred to before. So I think that can be helpful as a part of the warm handoff. If they don't want me to do it, I just recommend that they note that I referred. Okay, but maybe your question is, what if this is not a client? This is someone we just had a consultation with, and we determined like, hey, we're not a good fit, so I'm going to make this referral. For the most part, I will provide multiple options, and I will encourage the person to reach out on their own. The reason for that is I don't want to mistake doing a warm referral as like endorsing that particular person. So if I don't know about their availability, then it would behoove the client to reach out and ask them about it. If I don't know for sure that they take this insurance, it's going to be better for the client to reach out. Now, if that would be helpful for the potential client to have that type of warm handoff, then I just make sure I get their consent for that. I think that's what it kind of comes down to at the end of the day. For most folks, they're good with having referrals and reaching out on their own. But whether it's a potential client or a current client, if they want my help in reaching out and making a warm handoff, then I'm just going to make sure I have the right consents in place. So making sure that that potential client has consented to it, maybe verbally, have it written down somewhere. If it's a current client, a little bit more protections there, making sure you have a signed release of information. So that was probably more than you expected when you asked that question, but let me know if that brings up other questions, or if you want to know more about the referral process. But I think really just find out what would be helpful for them, and then make sure that you have the consent to do that if you're reaching out on their behalf. I'll keep going, and then I'll check and see if you put anything else in the chat. Yeah, of course. Of course. Yeah. If you are private pay, so my practice is private pay, and sometimes we're not in network. So we need to make sure that we get referrals to others who are. I've kind of touched on that. But let's say the client does want to work with you. So essentially, you are not taking their insurance, you're not using their insurance, or maybe they don't have insurance. Regardless, if you're not paneled with an insurance that the client is using, I try to say that in different ways. If you're not using the insurance that they're paneled with because you're not paneled, now I'm going to confuse myself. You know what I'm saying? You need to make sure you cover the good faith estimate. And this came out, I think now it's been a couple of years, or maybe around a year. We've been talking about it for a while, and there's still a lot of confusion around the good faith estimate. You can find some information online. Folks have created trainings and templates and stuff like that. So definitely recommend you go check out more information. But the bottom line is, if you're not filing claims through insurance for a client where you are in network with their insurance policy, let them know that they have the right to get a good faith estimate. This is a part of the initial consultation paperwork that we use. Um, there is like a little document that they get that says you have the right to a good faith estimate. And then if they decide to schedule services with us or they request a good faith estimate, then we send them one. So there's two parts to this. The first one is they have the right to know that they can get a good faith estimate either when they schedule or at any time that they request it. They have the right to that. And then if they move forward with you and you schedule something, at that time, send them a good faith estimate, or at any time that they request one, send them a good faith estimate. I know that that is a topic for another day. We could probably spend an hour and a half just on that. So there's lots of templates and trainings out there. I encourage you to check out on good faith estimate. But the bottom line is they need to know that they have the right to one, and then you need to tell them that and provide one when requested. This was mentioned in the podcast about using your electronic healthcare record to allow potential clients to self schedule an initial consultation. I've seen discussions around if we're not using our EHR because it feels like if they're in our EHR, then they're a client, and you want to use something else that allows self scheduling. Does it need to be HIPAA compliant? That also is a legal question to ask an attorney. That may depend upon your state laws. And of course, it's going to depend upon the states that you are licensed in or have a privilege license in, and where the client is as well, about whether you use a EHR or use a different program to allow them to self schedule. I do think that this removes some barriers. So instead of reaching out and saying, like, hey, do you provide initial consultations? Yes, I do. When would you like to schedule? And then the back and forth about scheduling, they already know what your calendar looks like and they can go ahead and plug in. Some of the EHRs will allow them to choose a phone or a video session. You can incorporate some of the questions that I mentioned today into like a form that you send them or an acknowledgement when they are signing up for the initial consultation. You can provide the notice that they can receive, they will eventually receive, they have the right to receive and request a good faith estimate. So that notice can be in there. You could also include acknowledgement that this initial consultation is not therapy and it does not mean that we're starting a therapeutic relationship. So those are some of the pros to using the EHR. They can self-schedule, they can choose the day and the time that you've already made sure in your calendar is available. They can choose how they want to meet, if it's over the phone or if it's video. You can go ahead and ask some of those questions like contact methods, best contact method, what state they will be in, things like that. You can make sure to indicate that they have the right to receive a good faith estimate. Um, and then you can also include an acknowledgement that this is just a consultation and you are not starting a therapeutic relationship. With our platform that we use, and when they self schedule and it asks those questions, it also gives them an overview of what to expect. So I think that that is really, really helpful for most folks to kind of know what they're getting into. And it's helpful for us to see, have they read over this and do they understand it? Okay. And as I wrap up my topics, I'll talk about wrapping up the initial consultation. When we're wrapping up, and I think this was stated really well, I think in the YouTube video, the initial consultation is about validating the potential client and helping them find hope. They may be coming to you in a really tough place, and this initial consultation can help them see that there's something to do about it. There is a next step, whether that's with you or with someone else. It can help to put in place that hope or at least get them started in finding hope. As you're wrapping up, if you are not a good fit, please be honest about that and be prepared to give referrals. We at our practice have an ongoing spreadsheet with different tabs and headings and stuff like that for different types of services, different types of providers, who take different insurances, are located in different places, do virtual or in person. So we've got a whole spreadsheet that you can go through and just get kind of a list of referral options straight from that spreadsheet. So be honest if you're not a good fit and be prepared to give referrals. I think that's just good practice. If you are a good fit, at that point, ask them, how does this sound? How are you feeling about moving forward? Give them an opportunity to tell you if they think you are a good fit. And let them know if they decide to move forward, what to expect from you in terms of paperwork. What kind of paperwork is headed their way. So we let them know that there's going to be the professional disclosure statement, some of our practice policies to read and sign. How long will it take to fill out? And so for us, we're pretty generous. We say an hour. Doesn't usually take an hour, but it could. So just letting them know that it could take up to an hour. Our system saves as it goes, so we can let them know that. And then the other key here is clients don't know this already. When do you need the paperwork by? So make sure, I know that some people will just flat out cancel a session if the paperwork isn't in within like 48 hours of a session or something like that. That's fine. Again, like everyone has their own practices, but please let the potential client know that so they are aware that there's a deadline for the paperwork. I think can also be helpful to let them know why. So, filling out this intake paperwork gives me an idea of what you need, what your concerns are, where we can go. I have a starting place for the intake session. Be honest, just be straightforward about why you need this paperwork done in the first place, and also why you need it done within a certain amount of time. I need a few hours to be able to read over everything, start up my notes, and get prepared for you so that they're aware of that. I think that's, as you're wrapping up and moving forward, especially for those who have not been to therapy before, or maybe other practices have really short intake paperwork versus really long intake paperwork, or maybe it depends upon the services that you offer. Just giving them some insight into that process is really helpful. All right, we've come up on an hour and I've gone through all of my notes. I don't see any questions. So I will hang around for a couple minutes. If you do have questions, let me know. I'll be here. I can answer those from the chat or you can email them over. If you send them later, you're watching this a few days or weeks from now, you can still put them in the chat and I will be notified. You can also email me and I'm happy to respond to questions that way too. Yeah, so appreciative for y'all showing up. Um, I'm just grateful that I have the opportunity to share this information with y'all and that y'all are asking for it. So thank you for being here. If you need to head out, please do. But if you have questions, I'll be here for a couple minutes. Of course. Thanks, y'all. All right. I'm not seeing any more questions. I know a few of you are still hanging around. So feel free to put those in the chat after I end the stream, or email them over to us, and I'll be happy to get back with you with some answers. But just again, appreciate y'all being here. Have a great rest of your week. Thanks. Bye.